So June's husband is housebound, and these are the options she has. What would you say she should do in these circumstances?
Well, she should contact her GP, I think. I mean, we've already done 17 million booster jabs, and many of those are vulnerable people or in care homes or in their own homes. And some have had people come to their own homes, where that's been possible. But she should get in touch with her GP, because I think she probably needs more assistance for somebody to help her husband get it in a setting close to home.
Do you think her GP will be able to give her husband the COVID booster?
Well, there's GPs, there's pharmacies, there's local vaccination centres. It sounds as though she hasn't had much luck with those, but I would say there's lots of GPs and pharmacies also that offer the booster jab. So she should definitely contact her GP.
But I think that the problem this time, as far as GP involvement is concerned, is because they are now under all their normal constraints of having to put through all the normal work they do, the health checks, for example. That is back in a way it wasn't in the initial stage of the vaccination programme. So they are calling for them to be freed from those constraints so that they can get back in and stuck into the vaccination rollout in this phase as they were in the beginning. Will you do that?
No, we have obviously to keep things going as well. I mean, there's many other health concerns. So, same with the acute hospitals, etc. And it is a careful balancing act. But of course, we have community nurses who do the vast majority, GPs, pharmacies, retired nurses and doctors as well. And also we'll be operationalising the plan to what we'll be doing now is doubling the eligible people for boosters. So we will be putting that plan in place. Indeed. And working out how to do that.
Well, that's it. So what is the plan for more capacity?
Well, we'll be working that out in the next couple of days, but we have the people, we have the vaccines, we have the ability to set up new pop-up centres if we need to. They'll be working on operationalising this and also getting the system up to date to reflect the 3-month interval.
Who are the people you're talking about?
Well, last time we had retired nurses and doctors. We had many volunteers who had the right training. We had community nurses. We had GPs. We had a lot of pharmacies around the country. All of that. There's a whole host of people who had that capability, and we'll be looking at what we need to do to operationalise this time.
But we need more this time, don't we? Because we're in this very intense phase with the significant expansion of the vaccination programme. When do you imagine being able to get all of those who are now eligible, everyone over 18, their booster jab by?
Well, they'll be operationalising in the next couple of days. That plan will come out and that will have some target dates in, I'm sure. We're pretty good at it. We have a lot of people who can do it, and, we're pretty confident that we'll be able to roll out this booster jab as quickly as possible even though we only got the instruction yesterday that it was going to be double the amount of people, we are confident that we'll be able to do that, and we'll come forward
with the plan. Mid to late February looks like the most likely point, which of course is well in towards the winter, and indeed towards the end of the winter.
Well, it's the end of November today, and we found out yesterday. So, of course, winter will be a factor because we're already in it to some degree. In fact, it's very cold at the moment. It feels like it's winter. But, we will be operationalising this. We'll be coming up with a plan. It'll be here in the next couple of days that you'll have the plan with the answers to all of your questions. And, of course, we're confident that we'll be able to do this.
Face masks, now that they're mandatory again on public transport in England and in shops, how will that be enforced?
Well, largely due to the good sense of British people who will hopefully listen to the rules, try to protect each other, and do what the right thing is. That's largely how it's always been. I mean, that's pretty much what's always been. But the police do have powers to enforce.
Yeah, but are you going to be asking them to go on patrol more? That's what people who work on the transport system are now hoping for, because you've decided to make this big change for fines to be applicable. But is there a plan to try and make sure that people are complying? What if people don't show the good sense you're hoping for?
Well, of course, we have more police on the streets anyway. We've been boosting our police numbers, but that's really a last resort. We police by consent. We try to, we haven't been completely draconian as some other countries have, and so far that's worked pretty well because the British public have responded increasingly well to all of these restrictions, and it's really for us to be sensible. But of course, the police do have the powers to enforce a fine.
Gillian Keegan, Minister for Care and Mental Health, thank you.